Hello, everybody, and welcome to Ask the CEO. Today, we're going to discuss data and AI in healthcare, as well as the IBM Z Day, and we're joined with a panel of experts in health tech and the data privacy sectors. So what I'd like to do is I'll introduce myself, and then we'll go around the room, and everybody will introduce themselves, and we'll kick this off. So I'm Avrohom, founder and CEO of Ask the CEO Media, where I help businesses get heard over the noise on social media with thought leadership and influencer marketing. Melissa, why don't you go next?
Hey everyone, I'm Dr. Melissa Sassi, and I am a venture partner at Machine Lab Ventures. Thank you, Avrohom, for having us.
Absolutely. Dr. Young.
Thanks for having me today. My name is Ryan Young. I'm an MD MBA with a background in quantitative finance, artificial intelligence, and medical natural language processing. And I'm founder and CEO of Apollo Technologies, a fintech healthcare AI company. I'm super excited to be here today.
Great to have you. Tyler.
Thank you so much for having me. I am CEO and co-founder of an early stage health tech startup called Dark Kryptonite. And I also worked for the Department of Defense Cybercrime Center doing forensics and have a pretty extensive cyber background. So I'm really excited to be here for this.
Awesome. I'm looking forward to hearing all about it. Dr. Castro.
My name is Dr. Harvey Castro. I'm an ER board certified doctor with over 20 years of ER experience. I'm also a former CEO for a healthcare system. And currently, I'm an advisor for AI in healthcare. Basically, I have a strong AI background, and I'm combining all three facets.
Great. I'm looking forward to hearing all about your experience. So we'll start with Dr. Melissa Sassi. Melissa, you've worked with startups quite a bit. What are the keys to startup success?
Well, first off, just to add context, I've built, and not just me. So when I say it definitely takes a team, and it definitely takes an amazing, founder and startup. But, I've scouted 225 startups, 75 countries, and founders have raised more than, $350, $400 million in investment capital the last time I checked. I built startup accelerators at both IBM and Microsoft, and been involved in the ecosystem as well as in my current role. And it's all about unlocking revenue. It's about unlocking the, kind of capital and money that you need to move things forward. But it's also about solving a problem, creating a solution. And in order to do that, you need to have access to enterprise partnerships. You need to have access to be able to be heard, especially in the health tech space. There are a lot of startups. So how can you have your voice heard? Let people know that you've got an amazing product, an amazing solution, and that it's out there and ready for you, all while protecting the sensitive data that you need to have protected.
Great. And, that message really resonates with me. I talk about that a lot as well, about, you could have a great product, but you need to get heard. Talking about startups, so Dr. Young, your startup, Apollo, you're getting a lot of support with the IBM partnership around data privacy and security. How is your partnership with IBM driving results by keeping data safe and secure, and also enabling you to be compliant?
Yeah, absolutely. First, just give the audience just a little bit of background about what we do at Apollo Technologies. Our flagship product is called the Apollo ecosystem. The first component of the Apollo ecosystem is called Apollo, which is an AI algorithm which provides more accurate surgery duration forecasts in number of minutes. The Apollo Exchange is the second component. The Apollo Exchange is a marketplace for healthcare facilities to sell medical services to payers. So, for example, as Apollo frees up more time, well, that healthcare facility then can say, hey, payer, we have more available space. We're an efficient, high quality, low cost facility. Send us more patients, which then allows for the payers to dispatch patients to efficient, high quality, low cost facilities. The facilities benefit because they are able to monetize their efficiency and achieve revenue growth, cost savings, as well as the Apollo Exchange allows for them to receive payment from the payers 100% in full next day. And then the payers are benefiting because they're able to reduce their insurance costs, as well as increase patient access to high quality, low cost facilities. We're super excited to be presenting with our attorneys at Barclay Damon, Bridget Steele and Kevin Sispansky, at IBM Z Day on Wednesday, October 18th from 1 o'clock to 1:30 p.m. Eastern Time in the data and AI track. Our session is really focused on how early stage startups, which process sensitive data, can utilize legal compliance, IT security, and IBM HyperProtect, which is the Fort Knox of data security, as an effective sales tool to earn the trust of risk-averse customers, and which are interested in actually adopting the startups' innovative solutions. In particular, Apollo Technologies, we if you want to learn a little bit more about, tune in on Wednesday. But just really quick, Apollo Technologies, we utilize IBM HyperProtect crypto services, which allows us to store keys used to encrypt sensitive healthcare data at rest, and IBM HyperProtect Virtual Private Cloud, which actually allows us to encrypt sensitive data as Apollo is processing it. If you want to learn the rest, again, check out our session on Wednesday at 1 o'clock. So I'll turn it back over to you, Avrohom. Thank you.
Thank you, Dr. Young. And yeah, I'm definitely going to tune into that. Today data breaches are rampant. I mean, it's not a day goes by that you don't hear about that. And especially for an early stage startup, that would definitely be my concern. How do I avoid that? And which is a great segue to Tyler, from your experience in the security industry. What is privacy by design, and why does it matter to health tech startups and technologists?
That's a great question. Privacy by design means that privacy has been put into the product from its inception, and that is something that's very important to me, but it's also important to other patients and healthcare providers. And one of the things that my company Dark Kryptonite does, which we are not yet a part of the IBM Accelerator program, but we're really excited to hear more about it. And what we offer is we kind of take a different stance. I've been in the cybersecurity industry for a very long time, and we've come to the point where cybersecurity awareness training really is not enough. You have to have really very good technical solutions to aid in privacy and making sure that data maintains its integrity. So we created Dark Kryptonite, and Dark Kryptonite is essentially an AI-powered browser as a SaaS platform with a completely closed-loop network. So you could put any of your IoT, you could put your most critical assets inside of the Dark Kryptonite network, and it cannot be found on the internet because it does not use the same types of protocols. So there's a lot of things that can be done with this. You can send massive amounts of information, never touching the internet, because if you are connected to the internet, you have a presence and you can be found. But Dark Kryptonite just takes it in a completely direction where there is no address, and it's very difficult for it to be found. And we're really hoping that this is going to help a lot of healthcare companies, and it's also going to help really keep patient privacy private. So very, very excited about that. And if you're trying to get a hold of me, you can reach me on LinkedIn, any social media platform. My name's Tyler Cohen Wood, or you can go to darkkryptonite.com. Thank you.
Great. And we'll definitely check that out. I really like that part about being relatively invisible, because especially in healthcare, that's a really big deal. And the fact that you're dealing with AI, I mean, that's a great segue to what Dr. Castro has expertise in. So Dr. Castro, how do you see physicians and others in healthcare using AI, and how is it impacting the quality of care as well as healthcare outcomes?
Yeah, excellent question. I'm going to start with saying that the average nurse in the United States is 54 years old, and with 20% of that being 65 and older. And so think about that. Our aging healthcare in the United States is aging. And in 10 years from now, if everybody were to stay working, we would have the average nurse being 64, with 20% of that being 74. And so my point is AI is going to help increase that quality for us. And, I love that something like Watson exists because it's helping us create better diagnostic tools. To give you a case in point, there's so much information. That's the other part of AI that I love, and that the average knowledge of a physician doubles every 30 days. Back in the 1950s, to give you a perspective, it was every 50 years. And so with the amount of information coming, to be able to give the best quality care, we need the best information and up to date. And so using these AI tools to help us with predictive analysis, we all have heard of these diagnostic assistants in healthcare. One of my buddies, I'm kind of jealous. He's working at an ER, and basically he has this instrument from AI. It allows a patient that comes in saying with stroke-like symptoms, and the AI is actually looking at the CAT scan and telling the ER doctor via text and saying, hey, this person's having a stroke. And then it's alarming the radiologist to say, hey, take a look at this. It looks like it's a stroke. And now they can start the stroke protocol right away. And so big picture in AI health, the last thing I want to just chat about is I'm really stoked about using AI to help discover new drugs. The average cost using AI has gone down by 90%. And so as a clinician, I'm thinking, man, there's some rare diseases out there that unfortunately the pharmaceutical company will not touch. But now using AI, guess what? It's now affordable, because now think about it, it's going down by 90%. And so now that brings to the last point that I want to talk about is personalized medicine. Using AI, in theory, I could take the human genome, break it down, and then create custom solutions for that individual, not for their race, not for the bell curve that we talk about. No, for that particular person. And so I'm really stoked about how AI is going to help us in healthcare.
Yeah, I'm really stoked about that. I mean, there's so many, like Tyler was talking about, rare diseases, right? And sometimes medicine is good for one person, but someone else just can't tolerate that. So I'm really excited to hear about that. So we were talking about the IBM partnership, and IBM is having an event in a few days from now on October 18th called IBM Z Day. Melissa, how would people go to register for this event and learn more about it?
Yeah, great question. Before I answer that, I just want to say, how awesome is it that, one day we could be in a position where technology can help people like me. Yesterday, I was laid up in the bed because my vertigo was doing its thing. And by the way, doctors that I've seen have no idea how to prevent that from happening. So I look forward to a day when Harvey and Tyler and Ryan, or Dr. Harvey, Dr. Ryan, all of the Dr. Harveys and Ryans and Tylers of the world can get together to say, hey, well, Melissa, here is what you can actually do. So you don't just disappear from work for a day and everybody wonder, what the hell happened to Melissa? Is she okay? Which, by the way, I am okay. All right, super. So now I'll go into the question. There are a number of great sessions. You heard Dr. Ryan share the session that he is a part of. Did you say that was at 1 o'clock, Ryan? Is that what you said?
Yes, 1 o'clock Eastern.
1 o'clock? Okay, cool. So 1 o'clock Eastern, and that session is 30 minutes. It's on the data and AR track. And forgive me if I'm looking up. I've got a screen up here helping me remember so I don't say the wrong thing. There's another one at 2:30, Data Tech for Good, the intersection between data ownership and impact. That's at 2:30. 3:30. This one you should, if you're a health tech, you're going to want to take part in this one. It is all about IBM Hyperprotect Accelerator, the cohort launch. You're going to hear about, what benefits IBM provides for you as a startup. Cloud credits, one-on-one tech support, all kinds of fun stuff. And then if you're around and you kind of want to see venture capitalists on the hot seat, the people who are supposed to be giving you money, and you want to kind of learn how they tick if you don't know already, 4 to 5 is the closing of the entire conference. It's called Venture Capitalist. I think this is the name of it, but they might have changed it. Venture Capitalist Game Show, an interactive startup session, live from New York. So
and
that's what I got. Yes.
And where would they go to register?
I guess you might need that, right? And we'll kind of take, if you get confused, we're going to put this in the comments. Is that right? Okay. So it's IBMZ.io/ask-the-CEO. That was my only job. That's what I was supposed to do. See, there we go. All right. Thanks, Avrohom.
Nice. I love that link. And then we can go around the room. How can people connect with you? So Melissa, if people want to connect with you to hear more about, the awesome work that you do helping ventures.
Well, I made it kind of easy. I have to look at, there we go. Dr. Melissa Sassi. You can find me on LinkedIn. You can also go to mlvp.io. Hopefully you got that. But also, on X, formerly known as Twitter, Mentor Africa with a K. Thank you.
Awesome. And Dr. Young?
You can find me on LinkedIn, Ryan Young, MD. Also, I wanted to plug our Chief Technology Officer, Pete Turner. He's also speaking at IBM Z Day as well at 3 o'clock Eastern Time. He's going to be engaging with Marcel Matron, who was the inventor of IBM Z. So it's actually pretty cool that we get to chat with Marcel and his expertise. So,
thank you, Dr. Ryan.
Yeah, it's the confidential computing fireside chat, and they'll also be talking with Sandeep Bada, who is a IBM architect, extremely knowledgeable, as well as several other prominent startup leaders and up-and-coming startups. So check out Pete's session as well. You just don't have to just tune in for me. And again, if you were looking to contact me, I just look for Ryan Young on LinkedIn, or you can just contact me just via email, Ryan, RYAN, at ApolloOPOLLO.ai. So thank you.
Awesome. Tyler?
You can find me LinkedIn, Twitter, X, whatever you call it, Threads, Facebook, Tyler Cohen Wood. I have the same name. You can also email me at tyler@darkkryptonite.com, which is on my LinkedIn profile as well. So look forward to hearing from people.
Great. And Dr. Castro?
Yeah, I'm on all the major social media. Mostly I like LinkedIn myself. So it's pretty simple. It's just the symbol at Harvey Castro MD. And then that's the same at all. So I'm on LinkedIn, Facebook, Twitter, YouTube, formerly known as X. And then sure, if you guys want to email me, feel free to email me directly at harveycastro4@gmail.com.
Great. And I see you're also on a lot of books.
Yes, I love writing. I've written over, 10, 12 books now on AI and healthcare. And so feel free to join me on Amazon. So I'm on there as well.
Awesome. And I can be reached at asktheceo.io. Thank you, everybody, for joining our session. I appreciate you sharing your time and your wisdom, and look forward to seeing you all in a couple of days on the IBM Z Day.
Thank you.
Thanks for having us. Appreciate it.
Thank you.